I'm really privileged for every person that is here tonight. It is very special to me. Each of you that are here have a special place in my life and my heart. And I have to say, dear Minister, all protocol observed, thank you so much for being here. And Professor Hester Klopper, with whom I've also worked and had a journey. And I don't really want to start mentioning people, because then I must mention each one of you. But I just need to say to all my colleagues, all my friends, family, you are very special to me, and I appreciate your presence. I understand I have about 3 hours to to do this, so just let me know if we're close to 2.5 hours, then I can hurry up a bit. What I would like to share with you, I've taken some liberties to do a different kind of inaugural lecture. I know Professor Foreman will get worried about that, because you never know what a nurse, gets up to. But I'll try my best to behave, Professor Foreman. So I will just highlight some of the aspects that Professor Foreman mentioned, just to have an image of that. Then also, I love trains. I think it's in our family. My brother, who is retired, still makes wooden trains that is given to the kids. It's just been always a special thing in our lives, so I can't really get away from trains. It is for me a very meaningful metaphor to use in any presentation. So we will board the train, we will be a bit on board, we will talk about stations that we always depart from and return to. And then some symbols on the side track that I thought would be meaningful for us all. Edna and Vincent Millay, I think, wrote a beautiful poem that I thought would be a beautiful backdrop for tonight. And she says, the railroad track is miles away, and the day is loud with voices speaking. Yet there isn't a train goes by all day, but I hear its whistle shrieking. All night there isn't a train goes by, though the night is still for sleep and dreaming. But I see its cinders red on the sky and hear its engines steaming. My heart is warm with friends I make, and better friends I'll not be knowing. Yet there isn't a train I wouldn't take, no matter where it is going. And I think that is very much true as I reflect on my life as an academic and a professional, that I've really taken all the trains that came my way, and they were exquisite journeys. So if I talk a little bit about the existential journey, I just want to state up front that I like existentialism, and I believe that individual existence is an absolute unique and primary fact, and that the essential character of us all is changing all the time. We are a product of our existence in the flux of time. So whoever we are here tonight is formed by our total past, to which we add in every moment of our lives. As tonight, for example, adds to who we are and will be in future. Just to highlight a little bit the journey, as Professor Foreman said, I had the privilege to work with KwaZulu-Natal, and those days still University of Natal, the University of the Free State, and then, of course, now Stellenbosch University. So I think that was already a great privilege to be able to be exposed to different higher education environments. And Professor Foreman referred to the virtual health teaching and learning space, and I thought just to show you a picture of that, because it was such a unique thing at that stage in nursing education, to have such a beautiful space where everything that opens and closed technology was available and to use. And it was a wonderful project as a techno geek to be involved with that. And we had all of these simulators, patient simulators, and so forth. And University of the Free State, and Tandy will know, they are building and building further on this specific educational endeavor. I've also had the privilege to work with, over time, and today still, with the Free State government, KwaZulu-Natal government, the Western Cape government in certain conditions, Mediclinic, Busamed, Life Healthcare, and Netcare. And we have representatives from most of these organizations here tonight. So I really appreciate the goodwill and the working relationship that we have. I just thought it might be interesting for you to see, if you work in the Middle East, the country logos look quite different. So the first one is the United Arab Emirates on the left, then it's the Sultanate of Oman, Bahrain, and then Saudi Arabia, and then my stint in Denmark, and then of course my heart in South Africa. In terms of organizations, ICN to some extent, Fundisa, the Dialogue on Diabetes and Depression, and then the World Health Organization as related to consultancy. I also feel it's the right thing to do tonight to acknowledge, because I might not have a public podium, maybe of this again, to acknowledge people in my life that have played a very important role. And the first two on the left, the first one is Aled Nell, who was the principal of the College of Nursing in the Free State. She learned me the ropes as a young academic of academic leadership. And then Professor Liana Uys, with whom I did my PhD. And I learned a lot. She was an amazing researcher and visionary, and we had a meaningful time together. In the middle is Fatima Rafai and her husband, Mohammed. She, at that stage, was the Federal Director of Nursing in the UAE. And we just had also a very meaningful relationship in my position as advisor in the UAE. And then Professor Hester Klopper, who I have the privilege of having here tonight, our connections and working together as colleagues and friends have also a very special meaning in my life. I also just highlighted some academics and colleagues here that has crossed my path, and some images I have, which I just wanted to share with you. Of course, Professor Chikta there, Ronel Kustas Tandi is there, Professor Jonathan Jansen, who's unfortunately leaving South Africa. I don't know if he's left already, but in my time in the Free State, he was also very supportive of nursing and of growth within nursing. My colleagues from the Free State, which is Dr. Professor Yvonne Botma and Professor Mulder. There I have some other colleagues that shared a lot of time with me in developing nursing. And then, of course, I think one of the most beautiful images of the minister at the Midwifery Day. These are just examples of seminars, workshops, presentations, and so forth that I have done in countries abroad. The last one I want to share really is that you can see who are my family and friends. I've tried to do a bit of a collage there, so I'm sure they will find themselves there. Unfortunately, my sister can't see very well, but I'm sure my godchild will tell her that she is there. Then Professor Forming mentioned that I like art. Unfortunately, in the academic life, though it's not a good excuse, there's not a lot of time for that, but I try to do it here and there. Ethelwyn will remember the work that we have done around the logo for our international conference that just shows really the process that it went through and eventually used as the logo for the conference. Fundisa, I also played a role in the design of that logo. And then also our 50-year celebration, I was tasked to do that. And then I leave all the other work and just do the designing. So it's very dangerous to give me artwork. And then in terms of my love for music and painting, this is just a small example of a painting that I did, I have to say already, I think in 2010. I haven't really been very active in painting lately. So that is just a little bit in images about myself. But I would like us now to actually start the journey that we have prepared for tonight. And if you've looked at the title of the address, I would like to talk a little bit, just as a background sketch, of broken, broke, and breaking, which in a sense relates some aspect of the healthcare and educational context. So what I'm saying would not just be applicable to healthcare, but also to, in my opinion, to higher education. The first thing is that we do accept that there's a great relationship between human rights, law, and dignity. The problem is, however, that the Constitution, the Bill of Rights, sets fantastic standards there. But how do you deliver on expectations if you are all the time hampered by numerous realities, for example, financial and so forth? I think I have to say I really admire anybody currently in an executive position, because life is so tough up there to work with so little that you have to achieve so much. But this is also not just in South Africa, it is a global reality. Rispel in 2015 wrote that there's 3 fault lines visible when we talk about healthcare, and I think this is maybe applicable to some higher education institutions as well. It's the issues of leadership, management, and governance failure, the district health system, that is more related to health, and the health workforce crisis. And that has again been underlined just now when there was discussing the extension of the HIV/AIDS treatment and the issue around human resource availability. The broke word is used in a tongue-in-the-cheek way. Is if I look at what universities, higher healthcare, what you have to work with, so little that you have in terms of finance to still provide a meaningful service. And I don't think that will be easier when we actually bring in the national health insurance system, because again, expectations, how do we link the expectations with the actual cost and covering? So for me, that is the million-dollar question. But I think what tonight for me is about is not so much that, the outside realities, but the inside realities. In the research that I've done and read about, the issue is around occupational health. And there's quite disconcerting evidence that the health of health carers, healthcare professionals, educationists, and so forth are really not. We are not a healthy lot. We are the Department of Medicine and Health Sciences, but the health of us all, may be something that we need to look at, and that is true for every university. There's a great increase in communicable and non-communicable disease, which must have a negative effect on what we face. So the personal and human burden of what we have to deal with as academics, as practitioners, is not always so much at the forefront. We try snippets of support, but it is really the reality of, may I say, inhuman expectations of us all. How can we do what we have to do with so little time, so little resources, and so forth? And I think the thing that worries me the most, and I've read a bit in terms of the medical sciences, is that human brokenness, when you have served and worked with a patient and something goes wrong and the patient gets more ill or does not survive, there's always this question, could I not have done more? Could I not have been more effective in my treatment? Was there something else that I could have done? And that adds to the personal suffering. And that's the stuff we can't measure. And that is not really looking at, we don't really look at that. I was interested in the work of David Hilfiger. I don't know if any of you have come across his work, but already in 1984 he created a lot of hoo-ha, because he wrote an article in a well-reputed journal on facing our mistakes. And he actually wrote about the mistakes he recently made in his practice as a general practitioner. And what was interesting for me was at that time the colleague responses when he wrote this article. The one lot said, "You don't know what you're doing, you are just not competent," etc., etc. The other lot said, actually what you need to do next time is follow this guideline, read this article, go for this training. Whilst a third group actually said, "Thank you, there's someone who expresses what we go through in our daily lives as health carers, and we need to talk about this more." But I still don't see a lot of talking about this, about the realities we face every day. I think what is important for me, if we talk about the theme, is to, and there's a little bit of Leonard Cohen, Professor, is to say that Leonard Cohen wrote a song called The Anthem. And he literally took 10 years to write that song. By the way, I didn't know our rector very well when I heard him the first time. But when he said he loves Leonard Cohen, he was my man. So Leonard Cohen then took 10 years to write this, till someone told him, "This is perfect now, just record it." And the song is really about, the bells ring, the birds sing. Don't dwell on what has passed away or what is yet to be. You can add up the parts, but you won't have the sum. Ring the bells that still can ring, and forget your perfect offering. There is a crack in everything. That's how the light comes in. And that is the poignant message of Leonard Cohen to us all, us as humans and as academics and healthcare providers. A crack has purpose. It is with the confrontation with the brokenness of things where it lies, says Leonard Cohen. The other reality that we face often as human beings is that we are essentially, as academics and as healthcare providers, the mirror of a system that is maybe at the moment not where it should be in education and in healthcare. And we may experience a sense of despair and helplessness and loss. And we don't really know the hidden tolls and realities of what we have to face. And I think there's also at times evidence of abuse. And interesting, the abuse is often ourselves. If there's such a concept as a self-abuse, if I may use that, because we are so critical of ourselves in terms of what we do and whether we do it good enough. Our standards are extremely high. Courage, also for me an important concept. It's not something we talk a lot about. We talk about courage in the moment. There's a tortoise in the middle of the street and we quickly run and take it out of harm's way. We will rush and help a patient or a colleague or so forth. Spontaneous courage. But the most difficult form of courage, in my understanding, is complex reflective courage. We actually in time deeply reflect intellectually and morally about decisions you make. And I think, for example, for me, in my involvement with the design of the undergraduate program, that was so. It was a deep intellectual and moral reflection on the right thing to do. But that kind of reflection is very heavy and serious and strenuous. Asking a very difficult question at a faculty board or at a Senate meeting is just as a courageous thing to do. But it is training, and if you have to do that too often, it becomes very, very tiring. So now we have boarded the train. You will be happy that we are now finally on the train. And we're going to talk a little bit about human dignity, which is clearly linked to what we have said before. Do we consider human dignity to be necessary and rightful? Now, through the ages, and Professor Moodley is here as well with her understanding of ethics and philosophy, and Nicola, there's been so much talk about human dignity over the ages. If I can just, and of course culminated in the United Nations Bill of Human Rights. But let's give you a quick overview of what happened in history. In the Roman and Greek civilization, we said that human dignity is something of value and worth and status. So it's a superiority thing. It's a looking down on others. That was the initial start of human dignity. In the Middle Ages, in the work of Thomas Aquinas, it was very much linked to personhood, love of our neighbor, and it had strong religious roots that we followed. In the age of the Enlightenment, with Kant, Rousseau, and Hume, the philosophers, human dignity wasn't that often referred to, but it was very much part of the whole imperative of reason and the requirement for respect. And then the relationship between human dignity and respect comes to the forefront. Post-modernity became a tool for self-esteem and political influence. And I think that is where we are now, and in the United Nations Declaration of Rights, this clear link to rights and dignity. In some controversies, which I found interesting, is that on the one hand, some people say the concept of human dignity is really useless. It means nothing. It's like the smell of a bread or the cover of a book. It doesn't help anything in understanding. While others say it is a very critical concept, and especially, and that's for me interesting, in the context of violating human dignity. That is where the issue lies. Is if you violate human dignity, it becomes a strong political, and we have ample examples of that. Of course, the chicken and the egg situation between human dignity and human rights. And we have numerous examples of society's failures, more failures than successes, in protecting human dignity at both the individual and collective level. If we now look at the stations where we depart and return from, this is what I really want to talk about and to say, is that if this is the context that we live, these are the core concepts, is the context, the concepts, what are the things in my experience of a time and what I do still believe would be the most important? And I think, sorry about that. I think this statement by Baldock makes, for me, very important. I have a very basic need as a human being, a need to be loved and cherished for who I am, not for what I look like, nor for what I accomplish or produce, nor for what I have to give. My deepest need as a person, the need I believe I share in common with all humanity, is the need to be truly known, and once known, loved and accepted unconditionally. Now, you may think that is euphoric, that is, I'm reaching in the sky, but if we don't accept that that is where all starts from, and that is really the only solution to go back to, the station we move from and go back to. And I think there's three concepts that I'm briefly going to unpack for you, which is person-centeredness in the first situation. Now, I found this, and I thought this was very interesting, what a human being looks like, this way up and handled with care and fragile. But I was interested in the ingredients, and nearly 50% of it is about compassion and caring and stuff like that. So most of who we are is really related to that. When we talk about person-centeredness, I have to say that it is critical that the whole is more than the sum of the parts. And person-centeredness is based on a consciousness that is a shared reality and an embedded relationship amongst us all. It has strong value-based realities such as recognition, respect, and trust, linked with a self-identity and a free will. And again, I'm coming back to the idea, as you see the luggage there at the back, which is a very personal thing. I believe your luggage is yours and what you carry with you. Perfection is a myth. We can strive to be person-centered. We can do all we can, but perfection can't. And vulnerability and dependency is a reality. The issue with, we talk in nursing and in the health sciences a lot about patient-centeredness and learner-centeredness. Now, I personally think we are using too many concepts. Just let's talk about person-centeredness. And the Kitson, who is a nurse scholar, emphasized these following 5 themes. The one that you emphasize the human experience, that we're all human, that you respect values and beliefs, that you care holistically in an integrated way, communication is critical, and shared decision-making. So within healthcare, in education, that is the critical realities. I also think that at times we talk about patient-centeredness, etc., but it's often lip service, it's overindulgence of the use of the concept, and sometimes a plain flippant use of the concept of patient-centeredness or person-centeredness. So I don't think we should use the word if we don't really mean it and plan to apply it and make it real in what we do. The other concepts that I always like to talk about when we talk about humanity and dignity are these 4 concepts. Pity, of course, for me is always the one that's at the lower end of the scale. Because many of the philosophers say that it actually has a slightly negative thing. It's a bit of a looking down. Pity, I feel really sorry for you. It's a hierarchical relationship. It's not necessarily something that people really value or appreciate. So it's a bit of a shallow way of looking at that. Whilst if we look at sympathy and empathy, it is slightly different. Sympathy is a very spontaneous thing. Someone has a terrible loss or someone is very ill. You're spontaneously moved by the sadness of that person and the suffering, and you provide and you are with that person, feeling with the person. Whilst empathy is much known within the nursing and health professions and medical sciences, much more structured and designed approach to look at engaging with patients, and I would have to say colleagues. It uses both cognitive and affective domain, but there's sometimes maybe, because you talk about you have to put yourself in the shoes. Remember, we all learned that at university, but I'm not always sure if there's a little bit of a detachment and the separation. Compassion, I think, is for me always the concept that I love, because I went back to the literature on compassion, and there was a very recent study in 2016 which said that in the last 25 years there was so much written about compassion, and in the last 5 years a huge proliferation in the literature on compassion. And why? Because it remains a matter of concern. When nurses are criticized, when healthcarers are criticized, education is criticized, it's about you do not care, you do not show compassion. So people feel it's decreasing or it's even lacking. And this specific study looked at 4 areas: the nature of compassion, the development, how does it develop, what are the interpersonal qualities you need and skills. Compassion, to summarize it, is a relational thing. It is the ability to recognize suffering or difficulty, to understand it, to be truly concerned about it, and then to act. and reflect. So it's not a passive process. Compassion is not something that happens just like that. And we are moved by the pain of the other, but there is still the ability to discern boundaries. And we have a clear developed sense of fairness that is specific to the situation. I think the difficult thing for me is to keep compassion alive, because we are so confronted so often with so many challenges related to compassion. And if you see it over and over and again, how do you maintain that heightened sense of compassion? But one of the greatest philosophers, Marcuse, said, "Look, I know wherein our most basic value judgments are rooted, in compassion, in our sense of the suffering of others." This needs to come together in a sense of communitas, which is an evolving concept, which is that we are united by a certain property. And I would like that property in the health sciences and in education to be compassion, because that will bring us together on a sound and equal and humane footing, so that we commonly experience ways of compassion and to live with that. We will still have stretches and strains. That won't go away, but if our base, our station, where we move from is compassion, I believe there's hope for us all, because that's what makes us feel warm and cared for. And I don't think compassion we can fake easily. It's not something that you can pretend. So a healthy collaboration in terms of communitas is important. And I would like to give a few examples of how to strengthen compassion. If we look at innovative programs, for example, the bachelor's program that we've designed is very, very much linked to person-centeredness, to compassion, and to the caregiver and recipient of care. So that in those programs, the compassion is really the golden thread and the goal of the program. In research, I believe we have to look much broader at the intricacies of care, much broader than quantitative research, but rather use the beauty of mixed methodology. In healthcare provision, we need to work around and with all of us together on a new configuration of communities. What do we really stand together on, and what do we differ? And being one of that. And I want to close with the following symbolism or metaphor in terms of healing. At the station, we saw this funny train wagon there, and it had something on it which I haven't seen before, which is a beautiful Japanese bowl. And it's about kintsugi. I'm not sure if you know that, but that means golden joinery. And it's really the art of repairing a broken ceramic by enhancing the fault lines with solid gold. So you don't throw broken things away. You actually make them more beautiful and more gracious in a sense that beautifies the object. The interesting thing, the history about this, is that a famous Japanese shogun had a very precious Chinese tebow, and it fell and broke. And the practice in those days was to repair it, as you can see there, with metal staples. And he really didn't like that. So he challenged one of his own workmen in Japan to come up with something different. And that is where the birth of kintsugi happened. So it is closely linked to wasabi, but it's philosophy that accepts transience and imperfection. So in essence, it's not about rejecting our brokenness, but to carefully beautify it, to embrace our human dignity in all its possible forms, to place person-centeredness at the center, to truly engage and repair hurt, hopelessness, and division. And that is really not a destiny, but a journey. And I remember this image from the midwifery day, and when I looked at it and preparing this, I kind of saw something of that in this very spontaneous image that talks to healing. And I would like to finish with my heart, with a poem that I started off with. My heart is warm with friends I make, and better friends I'll not be knowing. Yet there isn't a train I wouldn't take, no matter where it is going. Because there is a crack in everything. That's how the light gets in. Thank you very much.